Assalamualaikum and hi everyone. So for today, our group will be talking about sleep disparities. Sleep disparity mean the differences in sleep quality and duration among different racial or ethnic groups. In the United States, based on JAC 2022, studies show that African Americans and Hispanics usually experience shorter sleep and have a higher risk of sleep apnea, while white Americans generally enjoy better sleep outcomes. In Malaysia, it based on TAN 2021 found that Malays, Chinese, and Indians have different rates of insomnia, snoring, and daytime sleepiness. These differences are influenced by factors like socioeconomic status, cultural practices, working hours, and access to healthcare. The key concept of this issue is behavior. It can be defined as the manifestations of our belief and values that we express outwardly. Belief and values influence our communicative behavior. Sleep habits, including sleep duration and quality, are behaviors that affect daily functioning. Poor sleep can cause tiredness, poor focus, and forgetfulness. Sleep disparities shows that some groups, such as non-white and lower-income adults, often experience worse sleep, leading to health and behavioral issues. In the US, studies showed clear differences in sleep duration and sleep quality among racial and ethnic groups. Based on the results, non-white participants, Black and Hispanic individuals, had shorter sleep duration, poorer sleep quality, and more daytime sleepiness compared to white participants. However, when behavioral factors were considered, these differences remain largely unchanged. Overall, the findings suggest that non-white adults and those with lower socioeconomic status tend to have less favorable sleep patterns than white adults. Based on the observations, Black and Hispanic participants were less likely to report using sleeping pills at least 5 times a month compared to white participants. However, Black were more likely to report difficulties related to eating and using the phone due to real sleep problems compared to whites. On average, Hispanic and white participants reported sleeping 24 to 13 minutes longer than Black participants, indicating racial disparities in sleep duration. Studies rely on self-reported sleep duration and sleep quality, which can be biased. Differences in reporting may vary by race and ethnicity. This may cause inaccurate comparison between racial and ethnic groups. Even with statistical adjustments, subjective bias may remain, so using objective measures like sleep trackers is essential.
Sleep hygiene relates to daily behavior that promote better sleep, such as keeping a regular bedtime, avoiding caffeine, and reducing screen time. In Malaysia, many university students know these practices but struggle to apply them, showing a gap between knowledge and actions. So the evidence, a study on 380 Malaysian university students found that even though many practice good sleep hygiene, they still experience poor sleep quality like difficulty sleeping and daytime tiredness. So the study highlights that even though many Malaysian university practice good sleep hygiene, poor sleep quality is still common. This shows that awareness alone is not enough. Other factors like irregular study schedule, excessive screen use, and poor time management may reduce sleep quality. Therefore, improving sleep needs consistent habits and lifestyle change to achieve real behavioral change.
For the content 2, the key concept is discrimination refer to negative treatment or bias directed toward individual because of their background. This form of discrimination creates inequality, limit fair interaction, and produce threats that affect health and well-being. In the USA, studies show that African American and Hispanic people usually sleep less and have poorer sleep quality compared to white African people. A main reason is racial discrimination. For example, unfair treatment at work, stress from racism, and living in disadvantaged neighborhood, which then causes a sleep problem like insomnia.
In United States. The article examines how racial discrimination contributes to sleep disparities. Studies show that African American students had more sleep problems over time than white American students. Those who experienced more racial discriminations also had worse sleep. Students were asked to rate the extent to which and how often they felt they were treated unfairly because of their race or ethnicity.
In Malaysia, research show that poor sleep is common among all groups, but there are differences between Malay, Chinese, and India population. Some studies found that ethnicity is linked to sleep quality, while discrimination is not studied as much as in the USA. Factors like workplace or social bias and unequal stress across ethnic groups may explain these differences.
The article Sleep Quality was conducted to find out the factors among elderly people of Malay ethnicity, 18.5%, and other rest, 15.5% that cause them to have difficulty sleeping. A person's race or ethnicities affect sleep quality, meaning there are differences in sleep quality between ethnic groups such as Malays, Chinese, Indians. The article shows that ethnicity is a statistically significant factor, which means that the possibility that the difference in sleep quality between ethnicities is not a coincidence.
The first way Malaysia could respond to this is by promoting workplace and campus balance. This could mean making programs encouraging reasonable working hours, breaks, and rest-friendly policies that can prevent burnout and sleep deprivation. Universities can integrate sleep education workshops that teach students how to manage screen time, caffeine use, and study schedules effectively. They could also incorporate cultural awareness. Public health initiatives should respect Malaysia's multi-ethnic diversity, addressing cultural beliefs about sleep and rest. For example, tailoring awareness campaigns in multiple languages like Malay, Mandarin, Tamil, and English. This all helps reach all communities effectively. They could also try to improve urban living conditions. Creating quieter residential areas, increasing access to green spaces, and reducing traffic noise can all improve sleep quality, especially in people who live in very urban areas.
Beyond policy, individual behaviors play a key role. Good sleep hygiene, such as consistent sleep schedules, limiting screen time before bed, and creating a calm sleep environment is crucial everywhere. However, sleep behavior is shaped by culture and circumstance. That's why both countries should promote community-based sleep programs, local health campaigns, school workshops, and apps to help people develop healthy sleep routines. Healthcare workers and educators should collaborate to make sleep health a normal topic of conversation, just like diet or exercise.
In the United States, reducing racial stress and improving healthcare equity can help restore rest. In Malaysia, balancing work, education, and lifestyle across culture can promote healthier sleep for all. When we value rest as much as productivity, we move closer to sleep equity, where everyone, regardless of race, ethnicity, has the opportunity to rest and recover and thrive.
Sleep disparities are influenced by race, ethnicity, and behavior. In the US, discrimination and inequality cause stress that affects sleep, especially among African Americans and Hispanic communities. In Malaysia, differences among Malays, Chinese, and Indians are caused by lifestyle and cultural stress. Since knowledge isn't enough, improving mental health support and allowing short naps can promote sleep equity so everyone has a fair chance to rest and stay healthy.